When we assess new learners, we are not filling out paperwork. We are setting the trajectory for services. This framework centers development, relationship, and clinical judgment before tools. It slows assessment down, prioritizes observation, and reminds us that understanding the learner comes first, always in ethical applied behavior analysis. This framework outlines a practical, developmentally informed approach to assessing new learners in applied behavior analysis. It is designed to guide early decisions without forcing a rigid timeline. Funding sources, service intensity, and learner availability will vary, but the progression generally applies. The purpose is not speed, the purpose is accuracy. Assessment must remain individualized, responsive to family priorities, and sensitive to learner readiness. These phases support clinical judgment rather than replace it, emphasizing flexibility, context, and thoughtful sequencing over automatic protocol completion. This structure protects learners from premature demands and poorly matched assessment expectations during early service entry phases. Phase one establishes the conditions for meaningful assessment. Before testing, clinicians focus on context and trust. This phase includes caregiver interviews, naturalistic observation, and indirect measures. Together, these steps inform how, when, and whether formal assessment should proceed based on learner responsiveness and relationship quality indicators observed. The process begins with a structured caregiver interview. This conversation identifies family priorities, learner goals, developmental history, previous services, and current concerns. Particular attention is paid to patterns surrounding antecedents and consequences related to challenging behavior. Next, the clinician conducts direct observation. At least one observation occurs in the learner's natural environment using low pressure interaction. The goal is not compliance or performance, the goal is information. Notes focus on how the learner responds to people, materials, routines, and everyday demands. These steps typically occur within the first days of services and provide essential context. Without this foundation, later skill probes risk being inaccurate, intrusive, or clinically misleading. They also help determine pacing, reinforcement needs, relationship strength, and whether demand, fading, or pairing must occur before structured assessment continues safely. This protects learner dignity while improving long term treatment validity and outcomes across settings, people, and instructional demands over time. Direct observation focuses on three key areas. The first is social connection, including awareness of others, initiation, responsiveness, and tolerance of requests. The second area is communication. Clinicians observe gaze shifts, gestures, vocalization movements, communication modality, and whether communication partners are valued. The third area is developmental performance. If report allows clinicians present a small number of developmentally appropriate tasks, the purpose is to observe response patterns, regulation, persistence, and problem solving. These observations guide assessment planning, help clinicians decide what to probe, what to delay, and what foundations must be strengthened before advancing expectations. This information prevents overwhelming learners, reduces false deficits, and aligns assessment demands with readiness, motivation, and emerging learning histories from earlier sessions. It also supports ethical decision making and more humane, effective intervention planning long term across programs, environments, stakeholders, and developmental trajectories as services evolve over time continuously.